How do you see your journey with CSIR? How did you see it growing?
So we have a long history.
Where do you see IMTech in next 10 years?
It was really challenging.
Do you take care of the regulatory aspects also?
It was really tough. The scientists actually don't realize.
How is IMTech fostering partnership to keep India at the forefront of science?
I can have an idea which no one else will have.
Medicines are expensive for general families. So how is CSIR working to make life-saving drugs and treatments more affordable? How do you see in next couple of years, how is it going to shape up?
Welcome Dr. Khosla to TechFluence.
Welcome Doctor to the TechFluence. As we all know, you celebrated 84th Foundation Day yesterday, that was 26th September. So how do you see your journey with CSIR? IMTech is for last 4 decades and CSIR since last 8 decades. So how did you see it growing?
Yeah, thank you first of all for having me on this podcast. And I joined IMTech, CSIR IMTech in 2020 as the director of this institute, and I have been a scientist with the organization called Center for DNA Fingerprinting and Diagnostics in Hyderabad for the previous 18 years, and after that I actually joined IMTech. The journey in IMTech has been really great with lots of challenges, because as you know, in 2020 is the year when we actually had COVID, and I joined during that particular period, and it was really challenging to actually take the institute and the society together during that period. So it was really tough that time, but we managed to help the society in several ways. After that, once things started subsiding and the pandemic was under control, we actually initiated several programs in IMTech, and these are programs for the future of the institute and for the scientific community. Because while we have a great infrastructure in IMTech, I think so one of the most important things to carry forward is the scientific legacy that we have of the institute. And for the last 6 years now, it's going to be 6 years, it's been great leading this great institution, and it has been wonderful interacting with the people here and actually taking different projects to fructification.
It's nice to know. It's a big journey, it's right, from a small lab to 47 acres of complete sprawling institute. So it's a long journey.
Long journey.
Right, yeah.
So Dr. Khosla, science and technology are changing very fast nowadays. Where do you see IMTech in next 10 years?
Yeah, so as you said that our journey was 40 years, is almost 40 years long, and this is basically the juvenile phase of our institute. What started in 1984 actually was the culmination of a dream to actually have an institute which actually supports the industrial microbiology needs. And few things that actually were started have now become the forte for the institute. They are become the base for any activity that we want to do in the next 40 years or the next 100 years. One of them has been a repository of microbes, which we call as MTCC. That was the vision that time of the founding director and the founding scientist, that India needed a repository of well-characterized microbial strains, and that's what one of the things that was set up that time. We also were one of the first few laboratories in India who supported the fermentation-based capabilities of the industry, because today, as you would know, any biological drug needs either to be tested on microbes or on cells, or they need to be produced by microbes, whether it is protein or whether drugs need to be tested on the microbes. And that is the capability that we actually initiated 40 years ago. But today, we have gone from strength to strength, and today it's much developed technologies that we are using in those fields. Over the years, we've also developed niche areas in the institute. For example, our infectious disease groups are one of the best in India, looking at not just tuberculosis but also on antimicrobial resistance. We are looking at Vibrio. We are looking at several other diseases that are caused by microbes.
So you're talking about MTCC Bank. It's one of the largest bank, and you told about some of the microbes. So how do you see in next couple of years, how is it going to shape up?
We have today almost 14,000 microbial strains which are well characterized, can be utilized by any academic scientist or by the industry. We have further another 15 to 20,000 other microbes which are yet to be characterized. Of course, that depends on what is the need of the researchers. But what we have been doing in the recent past are creating standards. One of the most important things that we think is required are standards, because whatever standards Indian industry uses, they are the ones that have been defined either by US or by Europe. And we have been in collaboration with the Indian Pharmacopoeia Commission. We've been actually trying to make strains which are standards for the Indian industry. We are also trying to have strains which actually Indian companies can utilize and are of Indian origin, because have been identified by Indian researchers. Because if IPC recognizes them and that's the collaboration, the cost of using these microbes would come down dramatically, because otherwise these have to be procured from abroad. And even though we have them, but any commercial activity, you have to depend on US companies, right? So the cost, the import substitution is huge if this can be. So that's one of the phases that we are actually looking at. Other thing that we are also in talks are for services which are standardized. For example, BIS, Bureau of Indian Standards, want to have standard assays for certain things where microbes are used. We've also been in talks with FSSAI because they also require microbial testing of foods.
As you spoke about standards, so food, like if we talk about, so do you take care of the regulatory aspects also?
We have a group of scientists who have gone through the regulatory processes. So we have the platform where we can actually advise people on regulatory aspects of using microbes or use of medicines, right? So we are in constant touch with the regulatory authorities, whether it is the National Biodiversity Authority or, as I said, IPC or for BIS. So we are also very well aware of the regulatory frameworks that are required. And with the BioE3 policy having come in, it's much more required, and that is where we can help the industry.
So, Doctor, how does CSIR help young scientists turn their lab work into real solution for industries and everyday life? And is there any project or invention you are really proud of?
Most of the scientists here actually have been trained in basic research on microbiology or molecular biology. It is important that many of these actually turn into things which can be utilized by the general public, and there are many examples of it. Many of the times it is the scientists actually don't realize that, and this is something of a lacuna in institutions like ours. But what CSIR has been doing over the last few years, maybe a decade, is actually developing what is called as the Business Development Group in the institute, where all the research work that needs to be published actually goes through a group of people who look at the potential of IP, potential for a business development or for commercialization, or whether a technology could actually be transferred to the industry. And while there have been slow growth in this particular process that CSI follows, but it has been gaining momentum, and from our own institute's perspective, several such projects are now being turned into what are called as fast track translation projects, and many such examples are there. But IMTech has been at the forefront of it even before that, because one of the most important commercialization of biotherapeutic happened in IMTech. So you would have heard of the name of streptokinase, which is a drug that is used for busting clots in the blood, and that was developed by one of the researchers in IMTech, who actually went on to become the director of the institute and then the director general of CSIR. So we have a long history of such turning basic projects into commercialization, and quite proud of these projects. Yeah.
So as you said that you have like people from CSIR, IMTech had been scaling up in the industry. So you have women scientists also, and I think you emphasize on WISER, right? WISER is your one of the very important initiative which you had been working. So how do you think this kind of initiative had been helping women scientists to come forward, or young women graduates to take up STEM studies? How do you see that?
WISER is one such example of the way the government has actually been trying to help women scientists to take up scientific research in various laboratories, whether it is CSIR or whether it is in universities. And it's very important that these kind of initiatives are taken by the government. Of course, CSIR is doing, but across the scientific agencies, whether it is CSIR, DBT, DST or ICMR, there are many such initiatives that are being taken up. I think so. It's not just about the money that they provide, but it is also a way to tell young women scientists that there are enough opportunities if they want to actually take it forward. But I must also say that if women or girls realize at that particular time that there would be lots of opportunities for them to take up science and also are initiated into science, it would be much more useful, because many times at that level, especially girl students don't realize that there are opportunities that would be given.
So do you think government is doing enough to start this at the early stages of academic, when the children are in a school? So is government is doing anything? Because yes, this is somewhere people don't land up, right? There's like some people who are passionate land up here. Otherwise, things are not known. So
I think so. There are enough initiatives like this. For example, CSIR has some initiative called Jigyasa, where the scientists actually go and interact with the school students. Okay. Of course, it's not specifically for girl students, but it is for general. Everybody. But those initiatives are very important, because I think so our society is such that, of course it is changing, but society is such that even today parents want only two professions for their children, and it's very difficult to wean parents away. I think so the students want to, but parents sometimes become little So but these initiatives are very important at the school level, because once the students know that such opportunities are available and this is another way of going about in your life, then those are important initiatives. And I think so Jigyasa is doing really wonderfully well. We also in IMTech ourselves, we have a what is called as which comes under skill development, but we actually also take school students for a month or 2 or 15 days. They can come and work in a lab, understand what research is. Maybe they might like it, maybe they don't like it.
Yes.
So those are very important initiatives. We also have in the Jigyasa program shadow a scientist. So they go in one lab. So those initiatives are there. I think so. So society has to change along with it.
So collaboration are crucial in today's research landscape. How is IMTech fostering partnership to keep India at the forefront of science?
It's a perfect question, because without collaborations, research doesn't work. I can have an idea which no one else will have, but that holds true for me as well, that I might not have an idea which someone else has. And only when you discuss, collaborate, only then such ideas fructify. I might know a technique which will be useful to someone else. You might have a technique which will be useful for me. These collaborations are very important even at the basic science level, and today there is a great emphasis on collaborations. There is no longer niche of people who actually work in silos. It's impossible today to work in silos. Previously, you could go into the jungle and then do some research on your own, walk around for days together. But today it is not possible, because the questions that are being asked are much more elaborate. Previously, you wanted to find one point in the whole triangle. Today, you want to find the whole triangle. So something like that. So collaborations are very important, and collaborations are also important when you want to do a mission project. For example, we actually did a project with ISRO, something that they didn't have the capabilities in. Of course, they are into space research. They wanted bioremediation or degradation of a waste that they generate, and we were able to help using our microbes that we work with, and the collaboration was a great success. It's all over that this is the only way forward. So I think so collaborations are very important in today's research. So another example of collaboration which we were able to do was during COVID, and where a biological lab from engineering, which is our sister concern CSIO, which is in Chandigarh, and a Central Building Research Institute actually came together to ask a very simple question, that can the COVID-19, the virus SARS-CoV-2, can it stay in is it active when it is in the air? And can we kill it when it is in the air? So the answer came from our collaboration with, they made a box in which we could test in the air, and CBRI teams actually, we told yes, they can be killed by UV, and only we could do that particular assays, and CBRI team, which is the building research, said yes, this type of box can be fitted into our HVAC ducts, the air conditioning ducts, and that success actually was manifold, because many people retrofitted their HVAC systems. Even the Lok Sabha, this particular system was retrofitted so that the air that is delivered is pure of COVID-19 virus.
So, Doctor, you touched upon COVID thing. So, can we ask about, are we more prepared for future pandemic?
Yes. So, this COVID-19 pandemic was a wake-up call for all of us that this can happen anytime later also, and it is important that we prepare ourselves for any such calamity that actually hits us. Over the last 6 years since I've been here, one of the things that we've been actively involved along with ICMR. So ICMR has actually initiated, of course DBT also had initiated some programs. So we have a biosafety laboratory, and during COVID, it was realized that if you wanted to study the virus, you needed a biosafe lab. And while it was available with us, there were hardly few labs across India that actually had biosafety labs. And we were able to actually, in the last 6 years, in collaboration with DBT, ICMR is pushing for it, and we now have a large number of laboratories across India which have the capabilities of studying viruses at biosafety level 3. We also have a biosafety level 4, but most of these viruses and bacteria which can be pathogenic are now can be studied in these laboratories, and very quickly. So we were able to quickly deliver during COVID because we had a biosafety lab. Now there are multiple institutions across. So this is one of the ways. Niti Aayog has been actually actively working with the laboratories to actually extend various other measures which will deal with which can deal with any future pandemic. So we are much more ready now.
That's a good thing. Yeah.
That's a good thing. So it's actually a good thing to know that we are much more ready. Yes. Coming back to CSIR IMTech. So medicines are expensive for general families. So how is CSIR working to make life-saving drugs and treatments more affordable and supportive to the normal families?
One of a very good example of such an effort actually comes from IMTech. So I was talking about streptokinase a little while ago, and before IMTech actually transferred the technology for production of streptokinase to the industry, if you wanted streptokinase from the market, which was actually imported, it was, if I am remembering right, anything between 20,000 to 30,000 you had to pay for a vial of streptokinase. But after technology transfer of streptokinase from IMTech, the cost came down to 1,700 rupees or so. So this is a perfect example of how Indian laboratories can actually help bring down, because indigenization of many technologies is very important for getting these prices down. Another example I pointed out earlier, which is our strains that we have in MTCC.
Yes.
And with IPC, we are actually trying to have what are called as indigenized strains which can be utilized by the industry. And again, to use the strains that are today available with companies from US or Europe, it can cost lakhs. But if we can bring our IPC certified indigenized strains of these, and IPC mandates that these have to be used, the cost will come down dramatically. And this is how, of course I am talking from IMTech perspective, but this perspective is also true for all institutions across, because there are several technologies which rely on scientific research to be done in India, and Cipla is one another great example how the generic drugs that they produce have brought down the cost of. So similar things should be replicated in all institutions across India.
Most people know CSIR as a research institute, and it's a big scientific research institute, but not everyone know how it touches their life. Like you talked about drug, how simplified you made this, right? So how does this innovations, touches normal life?
That is true. Very few people till recently knew a lot about CSIR. Scientists usually prefer to be in the background than in the forefront of. They are a little bit shy probably. But if I go through the journey of CSIR as a whole, you would have heard of the indelible ink that the Election Commission uses for marking fingers when you vote.
Yes.
Right? That was developed by CSIR. Very few people know that till 1960s, there was lot of need of milk. Milk production was very low in India, and children were malnourished because less availability of milk. And one of the ways to do was to give them the powder milk that was imported from abroad, mostly used to come from UK or probably even from US. Indians wanted to actually get indigenized milk powder, for example, and there was a problem because whatever the technologies available in the world, they were for cow milk. And you would know that the composition of buffalo milk, which Indians use more, is different from cow milk.
Yes.
And making milk powder of it was very, very difficult, and most experts said no, it can't be done. But one of our laboratories in CSIR actually developed the formula by which you could actually make milk powder of buffalo milk, and that was the one you would have seen, the Amul milk powder was the technology that was transferred by CSIR. So there are various things that CSIR has done over the years which very few people know.
So Dr. Khosla, many young Indians dreams of becoming scientists. What would you say to a student from a small town who hopes to work at CSIR one day?
Yeah, so one of the first things that I should say is, for being a scientist, you need to know or be inquisitive. You need to be a person who loves asking questions, because without asking questions, science doesn't go anywhere. And of course, there are other avenues for asking questions, but if you are interested in how or why things happen in the nature or something that you have seen, even in social sectors, questions are very important, because many times I see even in social sectors, the way questions are asked is very important. My supervisor, whom I did my PhD, Dr. Vani Brahmachari, there were two things that she actually learned from her. One was that questions should be important, and it should not be something that anyone can ask, something very specific. You should understand what is a tough question to ask. And the second is, when you ask a question, you should know how to answer it using the right experiments. What are the right experiments? For anyone who wants, a student who wants to become a scientist, I think so it's important if they have this bend of mind where you like asking questions. Today, most research institutions actually have platforms where they can actually come, as I told you about Jigyasa, you can come be part of laboratories for a short time. You might like the way things are being done, you might not like things are being done. It's up to you then to decide, but it's very important to understand, like all jobs that are around, all professions that are around, there are good things and bad things about each profession. Good thing is you get to answer some important questions, and it is important for a student to understand that, whether from a small town or from a big city, this inquisitiveness should be there in a person. Of course, it's also long and frustrating sometimes. The students also should learn how to be patient and be able to, if you want to do anything in a hurry, research is not for you. It takes time to do things. So there are a few things that actually are important in taking a science or a research as a career.
Good. Nice inputs, Dr. Khosla.
Thank you.
Thank you so much. Thank you so much for joining us at TechFluence.
Yeah, thank you so much, Dr. Khosla.
Thank you.